is a genetic blood disorder caused by an abnormal shape of the red blood cell. The priority nursing diagnosis for sickle cell anemia is impaired gas exchange. A few nursing interventions would be to monitor the patient's respiratory status, evaluate and manage the patient's level of pain, implement adequate fluid intake, monitor their hemoglobin, hematocrit, red blood cell counts, and reticulocyte counts, as well as provide supplemental oxygen as needed. A few patient education needs would be to take medications as needed to manage pain, balance rest and activity, maintain hydration, avoid quick changes in temperature, and adjust accordingly to the weather. Pain is one of the primary complications of sickle cell due to the lack of oxygen and death of the tissues. Other complications include organ damage, stroke, blindness, and pulmonary hypertension.
Oh my gosh! Hey girl!
Hey,
what you doing?
I'm just telling some people about sickle cell.
Sickle cell? I'm like an expert on sickle
Girl,
cell.
what do you know about sickle cell?
Did you know that some of the common manifestations of sickle cell anemia include pale yellow skin? Sometimes it can be like tinted yellow eyes. Dehydration is a really big one.
Ooh, yes.
They tend to get fevers a lot, fatigue, like the lack of oxygen and everything.
Right.
And what's another one? Pain. Did you talk about pain?
I did.
That is like the most common one. This is super cool.
Girl, thanks.
Me? What does that have to do with me? No. I'm not doing this with you. I'm not doing this with you.
Hi.
Okay. Hi.
How are you?
I'm fine.
Alrighty, I'm gonna come in and check on you, okay?
The nurse is here. Bye. Whatever. Jerk.
Alright, if you could verify your name and date of birth for me.
Ryan McCullum, March 23rd, 1993.
Alright, thank you. And how are you feeling today?
I'm okay.
Alrighty, and on a scale of 0 to 10, 0 being no pain, 10 being the worst, how would you say your pain is right now?
Right now, it's like a 5. Earlier, it was an 8. But now it's a 5, but it still really hurts.
So the pain medication did help you out some, right?
A little bit, yeah.
Okay, so where's the pain right now?
It's in my legs still. Majority of it is like around my knees and like my lower back.
Okay, well I'm going to take a listen to your lungs, okay?
Okay.
And take a deep breath for me. And breathe out. And do it again. Alright.
Oh!
Do it again. Alrighty. Thank you. Alrighty. Let's see how your O2 is doing right now, okay? Alrighty, we got an O2 sat of 95%. We're going to try to get that up just a little bit, right? Alrighty. Have you been out the bed any today?
No.
Alright, so we're going to try to get you out the bed and moving around just a tad, okay?
No, my legs hurt. I can't.
Well, we'll get a wheelchair for you, and I'll have the therapist come by maybe, and she can try to talk to you and get some small exercises for you.
In the wheelchair?
The wheelchair.
Okay.
Just roll around for a little bit, get you out the room, okay?
That sounds okay.
Okay, and how about, are you sexually active at all?
Yes.
Alrighty, and is there any chance that you could be pregnant?
I don't know.
You don't know?
No.
Okay, so we'll have the lab team come in and get some blood work done for you and also a pregnancy test.
Okay.
So we can see, and she'll let you know the reasons of why we're doing the lab test, okay?
Okay.
Alright, is there anything I can get for you right now? Alright, before I leave, I'm going to have you do this and send a spirometer to see if your oxygen is going to the lung capacity, okay? Just inhale for me. As good as you can. Alrighty. There's some pain there, I see. And go one more time. Alrighty. Thank you. Alrighty. Is there anything I can get for you before I leave?
No.
Alrighty, so I'm going to go make a few phone calls and see if we can get those orders in, okay?
Okay.
Alrighty, and we have the call light right there if you need anything, okay?
Okay.
Alrighty. Hi, Dr. Mallory. This is Maya calling from the first floor about the patient in room 110. Her name is Ryan McCullum. She's a 24-year-old female, came in with sickle cell anemia pain. I gave her oxycodone for her pain. She came in with a scale of 8 out of 10, and it has gone down to a 5 out of 10. The current medications that she's on right now is folic acid, hydroxyurea, hydrocodone, vitamin D, and she takes ibuprofen as needed, as well as the oxycodone. Her vital signs is 97/63, heart rate 69, respiration's 18, the temperature is 98.6, and O2 is 95%. She does have yellow tinted eyes currently. She's having trouble taking deep breaths. She says it is painful. S1, S2 noted in all cardiac fields. She is alert and oriented ×4. Her urine is concentrated and she has not had any bowel movements in the past 2 days. She has pain in the lower back, in the knees and legs. Her skin is dry and intact. Poor skin turgor. Capillary refill is more than 3 seconds. She has palpable lymph nodes right and left. She does have her mom here as support. She's concerned with missing school and she wants to go home. She stated that walking is painful and she doesn't really want to get out of bed. So I would recommend possibly asking for the therapist to come by to get her out of the bed and the wheelchair to roam around in the room, around the halls. And also she's unsure if she's pregnant or not, so possibly some blood work and get a pregnancy test as well. I would recommend them to come by and see her too. Alrighty, thank you.
Okay. So, all right, but exactly my point. You're still not even up here with me, and you the one stressing me out. Got me up here and laying in this hospital bed.
Hi, Mr. McCollum. I'm here to draw some blood. Is that okay?
Yeah. Okay. No, I'm gonna have to call you back. Whatever. Bye.
All right. Can I have your name and date of birth, please?
Ryan McCollum, March 23rd, 1993.
Okay. So have they ever explained to you what we're going to be drawing for?
No.
Okay. So with sickle cell, you're specific to crescent-shaped blood, like red blood cells. And usually normal red blood cells are donut-shaped, so it looks like a moon.
Oh.
So it's specific for hemoglobin S for sickle cell. So I just want to let you know that's what we're looking for. And if you are pregnant, we can also test the amniotic fluid of the placenta whenever your baby comes in, like second, third trimester, if it's in both you or your boyfriend.
Oh my God. So you're saying if I am pregnant and I have the baby, and if my boyfriend has the trait and I have the disease, my baby can come out with the disease?
There is a possibility. What we will do further then is we will test, we'll prick there, because all newborns are tested as well. We will see if you have 2 abnormal hemoglobin S traits, that means you're positive for the disease. Now, if you have only 1 and no symptoms, then that means you're just a carrier for the trait. So is that clear to you?
Yeah,
Do you understand? Okay.
I don't want to put my child through this if I am. You have to stick me?
Yes, I do. I'm sorry.
I hate needles.
I am complete. Thank you.
Can you tell me the results now?
No, ma'am. I have to take it to a lab, and we'll run it through some specific machines, and then they'll let you know whenever they get the results. Sound good?
Okay.
All right. Thank you for your time.
Thank you.
You're welcome.
I'm just so stressed out right now.
Miss McCullough?
Hi.
Hi, how are you?
Okay.
Good. My name is Jenny. I'm part of the therapist team here at Chamberlain Hospital. I understand you're in some pain.
Yes, a lot.
A lot? Tell me about your pain.
It's in my legs, and like in my lower back. I don't want to do anything. I just want to lay here. I wish I could get some more pain medicine, but it's not time.
Has the nurse given you anything for your pain?
She did. I think it's wearing off now, though.
Is it?
Yeah.
Okay. So what do you think maybe causes the pain?
Well, about 4 days ago, right before I was admitted,
Yes.
I had on my cute little sundress, and I was out with my girls. And it was nice, but this Georgia weather, it just keeps flip-flopping on us. And it just got rainy, and then I just started feeling pain in my joints and stuff. Yeah, so then I had to just come here, and then on top of being stressed out from school, full-time in school, and then I'm working full-time, and then my boyfriend, he's off the chain. This fool tried to break up with me. Do you know that?
No, I didn't know
I
that.
will kill him.
Oh,
Don't tell. Yeah, don't tell on me, please.
Well,
It's
I'm
just-
concerned
it's
a little bit.
It's just too much. I can't handle all of this. You know what I'm saying? I'm only 24. Why am I going through all of this? I don't understand. And then I gotta get out of here because if I miss class, then that pushes my graduation back. It's too much. I don't want to do it.
I'm sorry that you feel that way. I'm sorry. It's okay. Well, we're here for you. Okay?
Okay.
Miss McCullough, do you think anything else caused your pain outside that day?
I don't know. Just the stress, the weather.
Yeah?
You know, I've been trying to take my pain medications every day, but I miss a few days with just being overwhelmed with school and work and trying to make everybody happy, you know?
So you know you need to take the medications as directed, yes?
Yes. I
You're
know.
aware of this?
Yeah.
Do you ever work out?
I do.
Can I exercise? Yeah? How often
Yeah.
do you work out?
About 3 times a week.
Okay, that's good.
Yeah.
So aerobics, extra like weightlifting, both?
Cardio.
Cardio. You like cardio?
I like cardio.
When's the last time you worked out?
That morning, actually, before I was admitted.
So are you saying about 4 days ago? Is that what you're about to say? Saying?
Yeah.
I don't want to put words in that. You tell me.
Yeah, about 4 days ago.
Yeah?
hmm
How does exercise make you feel?
It makes me like feel uplifting. It makes me happy. You know, I don't feel like a sack of potatoes laying in this hospital bed.
I certainly understand.
You know?
So chemically, your body responds to that exercise.
Yeah.
In your brain, you have this chemical called serotonin.
Mhm.
It's sort of like your happy chemistry. Makes your smile happier.
Mhm.
Yeah. Would you like to get up and walk around a little bit?
No, I'm not walking anywhere.
You're not walking
Sorry.
anywhere. Your your legs. The whole leg is hurting as well.
Yeah.
Okay. So, what would you say? Would you be willing to go outside with me if I brought you a wheelchair and walk around, get some fresh air?
I would like that.
You'd like that?
Yeah.
Okay, perfect. Well, it's good talking to you. I'll be back in a little bit and check on you and bring that wheelchair. We'll go get some
Awesome.
fresh air together, okay?
Thank you so
Sound good?
much.
You're welcome.
I'll see you
Absolutely.
later.
Okay.
Alrighty. And since you're a little dehydrated, I brought you some water for you to drink first, okay? And
Okay.
I'm gonna need you to drink this before we get out in the hallway, alrighty? Before the therapist comes back to taking that wheelchair, alrighty?
Okay.
I'm gonna get that skin trigger back and get your skin back.
Hi. Do you know anyone who suffers from sickle cell anemia, the disease, or the trait? If so, you can put them in contact with the Sickle Cell Foundation of Georgia. Their website is sicklecellga.gov. For volunteer hours, if you're just interested in learning more, support groups, you can reach out to Pink Lotus Sickle Cell Foundation Corporation, and the cell phone number for that is 678-558-7144. Thanks, guys.
Sickle cell anemia is a genetic.
Hi, Dr.
Sickle cell anemia is a genetic blood disorder caused by an abnormal.
Okay. Sickle Cell Foundation of Georgia.
Skin back moist, okay? Wait.
IV starting in the morning.
Okay.
Sickle cell anemia is a genetic blood disorder caused by the abnormal shape of the red blood cell. This abnormal. Nope. Back up.